Recording in progress.
All right, Scotty, are you ready? Scotty, are you ready? All right, let me go have Donna comes up and then she do the intro and then we pass it over to you, okay?
Okay, thank you.
Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture and continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. Today's webinar is evidence-based acupuncture for depression presented by Scotty Hudson. The class will run from 9 to 6 p.m. Pacific time and we will have 4 breaks. And Scotty will let you know when those break times are, and lunch is scheduled from about 1 to 2 p.m. Pacific time. With recent world events, the world has shifted its focus to mental health and is now paying closer attention to it. It has even reflected in the webinars that we have been hosting recently in the recent years. In addition to today's treasure of a webinar, we also offer TCM mental health courses on anxiety, stress, and other topics at CEU courses on our website if you are interested in listening to them. They can be purchased individually or accessed for free as a Gold Pass member. Now for important details about the chat room, questions for the instructor, and your CEU quiz. So the chat room. The chat room, please set your chat room to everyone so that everyone can be part of the conversation. By default, it is only sent to the host, so only the instructor or the staff can see it. And secondly, if you have any questions for Scotty, we ask that you type these questions directly into the Q&A box. That way we have our questions separated from the regular chatter in the chat room, and we keep everything all organized. And lastly is your quiz. The quiz will be available the next working day, and an email will be sent to you when the quiz is ready. All right, guys. So our speaker today is Scotty Hudson, and he's one of our new speakers. He was originally trained in anthropology, and his area of concentration was the development of the human brain. Since obtaining his acupuncture license in 2007, he has spent the past 15 years conducting research on the mechanism of actions of acupuncture, as well as evidence-based understanding of the foundation of traditional Chinese medicine. In addition to teaching TCM at the Florida College of Integrative Medicine for the past 10 years, Scotty has experience working in outpatient psychiatry. We are very honored to have him join us today, so let's give him a big warm welcome. Scotty, please feel free to take over now and share your screen.
All right, thank you so much. What a wonderful introduction, and thank everyone for being here today on Saturday. So I'm going to share now. And yeah, evidence-based acupuncture for depression. Everybody knows someone, right, who has had some trouble with depression or some other mental concern. And acupuncture, as acupuncturists, we know is already great treatment for depression. We can do a lot of help there, and we can use our ancient philosophy to guide us. But there's been a lot of really great research that's come out in the last several years, actually last probably 10 to 15 years. And it's a good idea to get caught up with that, I think, and see how that can help inform our practice and get the best possible results that we can for our patients. So I'm gonna go ahead here just a second. Give me just a second. I had to pause my screen. My PowerPoint's a little glitchy at the moment, so hang on just a second. Bear with me. All right, now we're working. Okay, so learning objectives. What are we going to be able to get out of this course? Well, hopefully we're going to get the ability to come up with a template at the end that is evidence-based, that when we have patients that have depression, we can come to this template as kind of a clinical guide. Before we get there, though, we've got some other stuff we need to look at. And the first thing we'll do is we'll define evidence-based medicine, and we'll think about why this might be important for us as acupuncturists. The next thing we'll do is look at the basic diagnostic criteria for major depressive disorder according to the DSM-V. That's the Diagnostic Statistical Manual of Mental Disease, which is the sort of the gold standard for diagnosis in most Western countries, definitely in the US. Then we're going to look at the biological factors in the etiology of depression and depression disorders. And we're going to try to really get a good understanding of what's happening in the brain and the nervous system when people have depression. Once we've got that background, then we can start to look at some of the acupuncture studies that have been done, trying to figure out these biological mechanisms of action when we use acupuncture for depression. And we know it works, but how does it work, right? That's what we really want to try to get a feel for in that section. After we've done a good look at the research, then we can make a sort of a template, I like to call it, of evidence-based protocols that we can use when we have our depression patients. Along the way, we will think about using all of this evidence-based information to communicate effectively with our patients and with other medical practitioners. And we'll really think about how to incorporate a certain amount of biomedical language into our conversations. That's very helpful. Most people, we go to school as acupuncturists for a long time, and we spend a real long time learning all these sophisticated Chinese terms, liver qi stagnation, heart yin deficiency, and all these things. And it's really on us to make that translation into the biomedical language. So we'll think about that as we go along throughout the class. And then at the end, once you sort of have a good foundation here with this material, it's really great to let your patients know exactly what you're doing and why you're doing it and what the research is there. It really helps put them at ease, and education of the patient is really a kind of marketing. And for me, it's the best kind of marketing. I do a lot of educational workshops for average people, not for just acupuncturists. And they usually come away feeling like, wow, I was really skeptical. I didn't know what to expect. I heard about acupuncture, but now you've explained it in words that I'm familiar with. And I feel like, okay, this is something I want to try. All right, so those are our learning objectives. And now we'll look at the course contents. So as I say, first, we'll take a look at evidence-based practice. What is it? Why is it important for us as acupuncturists? And then we'll look at some details about the studies that we're going to look at, so we have a good understanding of how they function and what some of the terminology is and how do they really do this stuff. Next, when we look at the DSM-V definitions, we won't spend a ton of time on that. And we won't spend a ton of time on the diagnostic criteria because that's not that important for us as acupuncturists, but we should have an understanding of what's happening when someone goes to see a psychologist or a psychiatrist and they get this depression diagnosis, right? What really happened there? What was the process? And that is also going to be informative for us in thinking about treatment of acupuncture and what's the best course for a patient. We'll talk about that when we get there. And then the third part is where we'll go through our pretty good size review of acupuncture studies. And we're going to divide them up. We're going to look at some systematic reviews, which are large, broad scale reviews of lots of individual studies. And we'll have one section that focuses on mechanism of action research, which is my personal favorite. And then we will have another that looks at more human clinical trials. And after that, we will pick out a few studies that we're going to take kind of a deep dive on and go through in a little bit more detail and try to get a little more detailed understanding of what they did and maybe why they did it and then what the results were. Some systematic reviews are great. They give us a big picture kind of approach, but sometimes we lose the details there. And so some of them I want us to look at the details on. And then getting close to the end in part 4, we will develop this template, which is going to include things like the treatment time, the point prescription, the treatment frequency, electroacupuncture settings. And from that template, we will have a flexible guide to offer our patients the best treatment that we can. And then at the end, hopefully we have time for a few case studies. I've included a few in the PowerPoint, and then I've got a few more that we can look at. And actually, if anybody has a particular case study they would want to try to apply the template to, you can type that into the Q&A, and if we have time, we will try to do that for sure. And then at the end, you've got lots of great references that you can dig into even further. All right, so let's just go ahead and begin and start talking about evidence-based practice model. What is it? Well, we've got a definition here. The evidence-based practice uses current research to inform clinical decision-making and provide patients with the safest and best clinical outcome. I often begin with a new patient by explaining, I train traditionally, I use all of the foundational concepts of Chinese medicine, but I also like to incorporate modern research and modern evidence because that often gives us the safest and best clinical outcome. And so the three parts here: utilization of the best available research. I put the little star, the little asterisk by best. We're going to look at different studies, and some of them are better than others in some ways. Sometimes people will critique a study because it's really small. They only had a few individuals in the study, or maybe they didn't have a placebo control or a sham control, or it could be lots of reasons why you could kind of critique a study and say, well, the data that you're getting from there is okay, but we don't know if we can really trust it. And so we'll think about that kind of stuff. But I put the little asterisk there because sometimes those studies that might not be perfect contain nuggets of really good information that we can still use. Maybe they had an interesting point protocol, or maybe they had an interesting timing of when they gave the treatments or something. So we want to think about that in the future. What really means best available research, and what can we get out of it, right? The second bullet, incorporating individual clinical experience. And of course, this is really big. We go to school for a long time, we see a lot of patients, and we develop ideas, we develop knowledge based on our own clinical experience. So evidence-based practice doesn't mean your own experience goes out the window at all. It's just another leg of the chair, if you will. And it's really important. And then considering patient preference. What are their values? What are their expectations? What do they want to get out of the treatment? And what can they kind of tolerate in the treatment? Because every patient's different. And I think with acupuncturists, this is kind of second nature for us. We already know patients are all different. They're all individuals, and we have to treat each one as an individual. I do consider quite a bit my patient's preference and tolerance for the treatment when I'm developing the treatment plan, especially if it's a mental health case, because oftentimes they're stressed, maybe their tolerance to different sensations or different points is lower. And so I'll modify what I'm doing to really fit their experience so that it's positive and they want to come back, right? I think acupuncturists, we pretty much always do that. So that's not really a big one for us. Okay, so sometimes it seems like with acupuncture, there's maybe two schools. There's the evidence-based modern approach, and then there's the classics approach. I like both, actually. I love both. And I don't think that they are separate or apart from each other. I think they kind of work together to blend and supplement each other. And so I just put in here a couple additional considerations for the TCM practitioner, right? Evidence-based practice doesn't mean we forget the tradition or we forget the classical functions of points or anything like that. It's actually quite the opposite. We use those points a lot, and we use that traditional knowledge all the time. And the evidence is just something to enhance it. And hopefully by the end of today, we'll have seen lots of examples where you can take classic points and their functions like Du 20 and Yin Tong We know these points are great for all kinds of things, and they're really good for mental problems, whether it's depression, anxiety, or poor memory, what have you. They're really awesome. And now we've got lots of evidence as to kind of why they're so good at what they do. So just want to say that it's not a replacement, right? It's an addition, it's a supplement. Also, the evidence-based practice gives us a common language with which we can speak to conventional medical practitioners and our patients. You know, they haven't got a clue about all this sophisticated Chinese terminology, but they do understand the basics for the most part, all right, of biology, most of your patients. And even if they don't know, you know, very much about the hypothalamic pituitary adrenal axis, that still sounds much more in their field of knowledge than, you know, heart yin deficiency or whatever it might be. And of course, the conventional medical practitioners are happy to hear us speak in their language, and it makes so much more sense to them, right? And then, you know, as I kind of said before, for us as acupuncturists, the successful use of the evidence-based practice really asks us to synthesize this ancient, beautiful medicine that we learn with the modern understandings for each individual patient. That's kind of why I like the template approach, because we've got a structure that we can use to help guide us along and find out what we want to do, but it's flexible for each individual. And as long as we're talking about this evidence-based practice, you know, adding new information to Chinese medicine has always sort of been the case from the very beginning. And I remember when I was in school, I would read the herbal materia medica, and in the commentary section, they would have all the quotes from the ancient authors. And it was so interesting to me to watch through the generations. Each author would sort of critique, correct, and or add to the previous generation. And there's this old saying that Chinese medicine never throws anything away. You know, if it worked, we keep it. And if we find something else that works, we just add that to it, and we keep adding it, which is part of the reason why we have such a wide breadth of knowledge available to us, right? They never got rid of anything. After each generation, they would just keep adding to it. Well, it's the same thing now, right? What we've got with all of this great evidence-based sort of modern research that's happening, it's just adding to the tradition, just adding to what we already know. And I have to think people like Sun Simiao or Hua To, those guys, they would be so excited, right? They would be in anatomy class and they'd be studying all kinds of, you know, neurophysiology. They would want to know everything and have that sort of boost what we already know. There has been a little bit of a sluggishness, I think, in the schools to incorporate this. Board exam might be a little, I've heard recently the last few years, they've added more ideas like about mechanism of action and stuff like that, but maybe still lagging a little. So that's what we're here for today, right? To try and boost things up as best we can. And I do think it's also important to sometimes remember that where we are today is a little different than where we were 2,000 years ago. It's a different lifestyle. You know, they didn't have McDonald's or Ben and Jerry's 2,000 years ago. Didn't have social media 2,000 years ago, and so the world is a little different, and certainly our behavior and maybe I would like to say our propensity to mental health has suffered. Mental health conditions has suffered the last several years. So things are changing, and we got to keep up with that, and that's what we can do. I think it's also important, this last little statement, that, you know, sometimes we hear these myths and superstitions about what acupuncture can or can't do. And, you know, maybe it's true and maybe it's not. We don't know until we get some evidence, right? So I'm not much for myth and superstition. I like a bit more solid footing, and my patients do too, and yours do as well. So just some thoughts about this whole idea of evidence-based practice, how it fits in with what we're doing as acupuncturists. All right, so let's talk a little bit about the research that we're going to look at And it is important to have a good idea about the types of studies that are done, how they're done, and how useful they are, what we can really get out of them. So here a little bit. So the first bullet here, the current accepted model for clinical trials with medical intervention, right? This is the sort of the gold standard randomized placebo-controlled double-blind study, which was really invented for checking and seeing how well chemical interventions, pharmaceuticals worked. And it's very easy to do this kind of a study with pharmaceuticals because it's, pill format or maybe an injection, and it's easy to give someone a placebo like that. And then it's easy to double blind, and the person handing or administering the medication doesn't know if they're giving them the medication or not, right? In the pharmaceutical world, that's really easy to make that kind of a study. And a lot of the critique with the research that we look at is that acupuncture can't do that. Well, that's true, right? Because why? It's a physical intervention, right? Acupuncture, massage, chiropractic, physical therapy, these things are physical interventions in the body. And the practitioner, the one administering the treatment, has to know if they're doing the treatment, that's just how it works. And there's a lot that goes in there. So we can think about it broadly as that the sort of the current medical scientific model or paradigm needs some work, and it needs to work hard to find ways to include acupuncture and other physical types of medicine into the paradigm with modified versions of clinical trials, because I really don't see how we can double blind acupuncture. And when you read some of the really good research that's happening in cancer these days, they're aware of this and they think about it quite a bit, and they accept and they recognize that you have to develop new kinds of studies for this ancient but newly applied medicine. And the placebos are kind of challenging too sometimes. They've got lots of sham needles where they just sort of tap the skin. They don't really go into it, but that might be problematic sometimes. And oftentimes in the West, large sample size can be really difficult to obtain. In China and in Asia, they pretty well can get very large sample sizes, but over here, we sometimes struggle with that one. But those are just a couple issues. And then what comes out of that is when you see various researchers analyze these studies, right? They will come out with the statement that, well, it was conflicting results or it was inconclusive. And, on one hand, that may be accurate, but on the other hand, there's still a lot that we can get out of them. And actually not that many of them that come out of Asia are really that challenged. They've done a lot of great work over there, and we'll see some of that. I think we're still a little behind here, but that's okay. We're working. So if we're going to do evidence-based practice, the data from the clinical trials needs to be critically evaluated for its usefulness, and we can supplement it with the mechanism of action research on the same disorder. And when I talk about mechanism of action research, a lot of times I'm referring to these sort of what they call preclinical animal models. So for any kind of disorder you can imagine that they have a medication for, pharmaceutical, they've got an animal model for that type of disorder that they've tested it on. That's kind of the standard. Test the animal first, bless them, we appreciate their sacrifice, and then, we can try it on humans maybe, right, if it passes that one. Well, they do the same thing now with acupuncture, and a lot of the animal studies really are more rigorous and can give us a lot of insight. And we'll definitely take a look at some of that. Okay, so talking about the clinical trials a little bit more for humans, it is still impossible to double blind an acupuncture clinical trial. I saw a post someone made a little while back, a few months ago, that said there was one, but I didn't follow the link. I still don't know how the acupuncturist will know if they're doing it or not, right? As we know, as acupuncturists, you need to communicate with your patient, and needle placement, needle stimulation, all these things are critical to the result, right? So we have to let go of the double blind, I think. There have been, as I said, some improvements in the placebos. They've got the sham needles that they like to use. Sometimes they will, hook an electrode up to the patient and just not turn it on, and that's the placebo. Still some challenges with some of that stuff, but we're making progress there too. And still, right, the data from the human clinical trials is real important. We can get a lot of information out of it. And sometimes I like to pay attention to the method that's used in the trial. This is where you get some real juicy material, such as their point selection, how they tried to make some type of placebo or control, what was the length of the treatment time, what was the frequency of the treatment. These are really important data points that we can, if we can find a pattern of what seems to work better and then what doesn't, that really helps inform our practice. But of course, it's only one branch, right, of the evidence base. We've still got patient preference, and we've still got, our own clinical experience. And it's the intersection of all of those which give us the real evidence-based model. We do find, and this is awesome stuff, lots of the human studies now are using fMRI and various biomarkers to get us some more objective data, right? Some more concrete, measurable data about what acupuncture is really doing inside the body. And these are, things that once you start to look at it, you're like, and then you tell your patient about it and they're like, oh, I see. Yes, that makes sense. All right, let's try it. And if we want to speak to those outside of our own discipline, we've really got to translate it into their language. And here is a little snippet from a study that we're going to look at later on this afternoon. And this was from 2016. And this is just an example. We will look at this in more detail later, but just want to give you an example of what I'm talking about, right? This was from 2016. The article title, Repeated Acupuncture Treatments Modulate Amygdala Resting State Functional Connectivity of Depressive Patients. Here's the picture, one of the pictures of their MRI scan of the functional connectivity between different parts of the brain. The amygdala down in here is lit up, and there's that anterior cingulate cortex, maybe the putum in here, right? And what they'll do is they will take a baseline scan of the depressed people's brains, and then they'll administer treatment for X number of weeks, X number of treatments, and then they will do another scan of the brain, and they'll look to see how it's changed. And this, what they call the functional resting state functional connectivity, is a new, more recent particular type of MRI, which is really helpful at sort of showing the changes in the structure between, changes in the neuronal structure between different circuits. Their result, and again, we're going to look at this guy in more detail later, but their result was that acupuncture added to antidepressant treatment did improve the depression in the patients, and that its ability to do this was achieved through the limbic system, especially the amygdala and the anterior cingulate cortex, right? And we'll later on, we'll look at which points they used and kind of the details of this one. But I just wanted to introduce it early on as a good example of how, we could incorporate modern technology and sort of modern neuroimaging, right, into acupuncture treatment. It's a really cool one. And this next one is this is not one that we're going to talk about too much later, but I just put it in here because it's another good visualization of the type of sort of clinical work that can be done now, and give us lots of insight into variations between styles of acupuncture or acupuncture points. And so with this study, they had several volunteers and they needled the point stomach 36. And then first they would take a baseline scan of the brain, and then they would needle stomach 36, and then they would take another scan of the brain and see what had happened, right? And the first row that we see here is manual acupuncture. So they just insert the needle, and then they're looking to see what's happening in the amygdala, the hippocampus, cingulate area. They're just looking to see what changes might have occurred. And then same point, same person, they'll apply the 2 Hertz electroacupuncture to the stomach 36 point. And then they look and they see what's going on in the different areas. And then next they will try 100 Hertz in the same acupuncture point, stomach 36, and they will look and they will see the changes that might have happened. And then the bottom is the control. And the control is kind of like this superficial picking, scratching, they call it, basically tapping the point area with a very fine filament, which it causes sensation. They know it's there, but it doesn't penetrate the skin or anything like that. And then they'll take a look and they'll see what happened, right? And I have the reference for this. You guys can go and look up the full article later. It's a pretty interesting one, comparing basically manual acupuncture and different frequencies of electroacupuncture and the results in the brain. And their takeaway was each style or version of the application of acupuncture had different areas where it was specialized. They did find the 2 Hertz electroacupuncture seemed to have the broadest effects across the brain, at least. And we're going to find that this 2 Hertz is very popular in the treatment of depression as well, for lots of very good reasons. So pretty cool studies. Okay, something else that we're going to find in the studies on depression are rating scales. These are really common. Conventional medicine's been using these for a long time. We use them actually, whether we know it or not. Every time we ask our patient, what's your pain level on a 1 to 10, right? That's the numeric rating scale. And sometimes, we'll have the little picture where the first smiley face at 0, and then the red, frowny, upset face at 10. My pain is horrible, take me to the hospital, that kind of thing. Basic, rating scale. Well, they have particular ones for particular disorders, actually. Modern medicine's really fond of these things, and they can be useful. They can be very helpful, and they like to use them in the studies because that is a way to track the severity of the patient's symptoms over time, to get an idea about how effective the treatment was, and to offer later on perhaps some statistical analysis of the study based on what we get from the rating scales. And there's a few different ones that you find tend to come out more in the depression studies. And at the bottom here, we've got this Hamilton rating scale for depression, HAM-D. The Carroll rating scale is another popular one. And then I listed this thing called the treatment emergent symptom scale. Talk about that in a minute. But the HAM-D was invented a long time ago. And a lot of the studies that we look at, the human trials, this is what they'll be using, or they'll use some version of it. And I have here on this slide a little picture of the first page of the Hamilton rating scale for depression. And I don't want you to, memorize this thing or anything like that. It's not that important, but it is interesting and nice to know sort of how the diagnosis is made. And oftentimes they will include something like this. And actually, let's see, I have somewhere here. No, I didn't bring it out. Sorry. I have a copy of it in a folder, which I'm going to send to you. You see, I've got some other files down here that we're going to look at in a little bit, but I will send you the copy of that Hamilton scale. It's fun. You guys can look at it. And if you want, you can use it, right, with your patients. Nothing wrong with that. I would, you're not a psychologist, I mean, you might be, but as an acupuncturist, it's not our scope of practice to make the diagnosis. However, if you've got a patient and they're really kind of severe and you have them fill this out in the beginning, 4, 6, 8 weeks later, they're feeling so much better, have them fill it out again. And it is kind of a little bit more of we can say an objectification of their subjective improvement over time. And I do know some practitioners that like to use these. a long time ago, when I was in the psychiatric clinic, I did use them, but nowadays I don't use them really so much anymore. But it just want you guys to know about it, because we're going to see a lot of studies that use it. And like I say, I've got several files that once we've concluded the course, I will send them over to you all so that you can have those for your reference. So coming back here, this last one, the treatment emergent symptom scale. This is my favorite. And this, we're going to find a few different studies like to use it. This is a scale that will measure all different parts of your physiology during the course of the treatment. It measures liver function, kidney function, heart function, basic vital signs, all kinds of different physiological parameters. And what it's looking for is adverse events or side effects with the treatment. And so whenever they include this in an acupuncture study, I get excited, because it's like, yes, very nice. More confirmation that it is absolutely safe. And it's really safe. And we'll look at a couple of studies, and one in particular that is really awesome, because it was pretty heavy treatment they were giving these people, several leads on the head of high frequency E-stim, and guess what? It's all very safe. So just wanted to introduce those guys. All right, so we'll talk a little bit about biomarkers now. And biomarkers are also something that get me very excited in the acupuncture study. And we've just got some definition here. An objective measure of what's going on inside an organism at any given moment. Okay, and actually, most of us use biomarkers every day. On our soap note, if you check your patient's temperature, or their blood pressure, or pulse rate, or respiration rate, or their oxygen saturation of the blood, pulse oximeter, then you've taken, you've looked at some biomarkers when you've taken the vital signs. And I think things like blood pressure and cholesterol, right? Those are common biomarkers for things like cardiovascular health. And what we find is these biomarkers used in clinical research can really help us also untie and figure out the mechanisms of action in acupuncture, and point to something more objective and say, hey, wow, there was a change here, there was a change there. And yes, the acupuncture really is doing something in the body. And a biomarker can occur at all different levels biologically. And as it says here, oftentimes we're looking to collect blood, urine, or some kind of tissue, maybe in an animal study or something. We'll explore the biomarkers a little bit more here, and then especially as we go through the studies. So I've got the little graphic for us to look at, and I like the graphic because it kind of shows the importance of biomarkers all the way around. And so top little circle here, safety, right? Of course, the body is in homeostasis, and certain parameters of the biomarkers have to be maintained, blood pressure, pulse rate, right? We're familiar with those things. And then a change in a biomarker is oftentimes diagnostic. It can inform the physician about something that's happening. A certain level of a biomarker consistently could put us at risk for some disorder, right? It's very common these days to think about high cholesterol and risk for some heart condition or something like that. That's a common usage today. And then changes in the biomarkers can be sort of prognostic or predictive in the course of a patient's disorder or disease. And a biomarker can certainly tell us if there's been a response to a treatment, right? So these things are really useful. And as we look at the acupuncture studies, we'll see quite a bit of biomarker usage to try and help us understand what's happening there. So specifically, biomarkers, the little graphic here is taken from an article about innovations. And I think this is the title. It's a chapter from a book, Innovations in Biomarkers in Psychiatry. And the little graphic has a brain, post-mortem brain. So, they could do some interesting work on the brains of folks who've had major depressive disorder for their whole life after they pass. Of course, functional neuroimaging, we've already looked at a little bit of that. We'll see a little bit more as we go along. And then other things like plasma concentration of certain metabolites. We will see some studies that look at that one. Maybe something in the blood, the lymphocyte. Okay, that could be a marker for maybe some immune system concern or inflammatory concern. And checking cerebrospinal fluid, just a little snapshot to kind of think about how psychiatry or depression might be able to start to look at some different types of biomarkers. And as I say, they're important in both human trials and animal models. And identifying those biomarkers that change with acupuncture treatment is really neat. It really is. It helps us get a good idea about what's happening in the body, what's acupuncture really doing, right? We know Du 20 and Yin Tong are great for the Shen, great for the spirit, and can help with anxiety, depression, all kinds of things. But what are they really doing, right? The biomarkers are one way that we can get a good idea about that. And again, this is going to not only help us know how acupuncture works, but also dispel the myths, right? Allow us to be secure in what we're doing is safe and effective, and why. And again, the common language, right? That's really important as well. Oh, yeah, and objectifying the subjective experience that acupuncture works, right? So many people say, well, I know it works. Yeah, but how, right? Oh, I can tell. I feel so much better. Well, why? Oh, well, because, this changed and that changed. All right, so what we have here is a little graphic which is trying to bring together all of the biomarkers for depression. Well, I shouldn't say all, most or a lot of the biomarkers for depression that are currently being used in research. And I'm going to see if I can enlarge a few areas. Try that again. And hopefully you can see it. You can later on enlarge it on your own, but sources of where we could get the data about these particular markers: blood, saliva, urine, hair, feces, cerebrospinal fluid, and imaging, right? Some common sources for the biomarker. And we'll go through and we'll look at these because there's actually quite a bit here. Both the serum and plasma levels of brain-derived neurotrophic factor. Okay, we're going to find that this is something that's studied a lot and that changes with depression in the body. Also changes with chronic stress, and we're going to find that chronic stress and the depression are closely related, and also related to some endocrine changes, the cortisol levels in the body, the adrenocorticotropic hormone. These things we're going to find are really important, especially when there is a chronic stress component. Basic measurement of the hypothalamic pituitary adrenal axis. We're going to talk about that. And then over here, we've got some neurotransmitters listed: serotonin, norepinephrine, noradrenaline, dopamine, glutamate, glycine, GABA, histamine. We're going to find studies that are looking at those things as well. Metabolemics, which is looking at some of the trace metabolites that are in your system. We'll find this is a more recent addition to studies on depression. We'll take a look at that. Growth factors, we'll see a little bit on that one, not too much. Genetic considerations, right? Genetic biomarkers. And here they're looking perhaps at, they say telomere length or certain gene polymorphisms. We'll see one expression of that. And we'll talk a little bit about some of the epigenetic changes and what happens and where acupuncture might fit in with that. And then down here in the corner, this is a real important one: hippocampus volume. So looking at the size of this structure, hippocampus is a structure in your brain. and it's very much implicated in depression and a lot of other mental disorders. And they look at the size, they look at the connectivity that happens there between hippocampus and other structures, and it's really important. It really gets damaged with depression, or if it gets damaged due to stress, it can lead to depression. We'll talk about that in a little while. And then some neuroimaging markers looking at changes in the structure in different areas in the brain. A few metabolic factors, leptin, ghrelin. Those are popular. We won't talk about those today, I don't think. And then insulin, glucose, and lipids maybe have some stuff to do in there. And some systems that we can look at to gain biomarker information about depression. The inflammatory, neurotransmitter, neuroendocrine, metabolic growth factor, right? So if we look at this little graphic, they did a great job of, bring this guy back here. Okay, there we go. They did a great job of coalescing in one spot all kinds of different aspects of biology that relate to depression that can be investigated and that can be measured. And this is wonderful, because when we see acupuncture make people feel better or change an animal's behavior back to normal, we can now associate it with one of these many, many, many things. And also, I think this graphic does a reasonable job of helping us realize how complicated biologically depression is. And that's something we'll talk about a little bit when we talk about the modern diagnosis of depression and what's going on there. It's really a complicated thing internally, physically in the body. It's not just serotonin anymore. It's not just one neurotransmitter. It's a much more complex situation. And of course, you have the link for the whole article on this one, or that section from the book. Okay, so here we have a wonderful little graphic of a rat getting acupuncture, right? The animal studies are really important, and I included this picture because it's a little curious sometimes, right? How did they get them to sit still, or how do they manage to do the acupuncture to these mice or these rats or other small animals? And they have lots of interesting little sort of restraining devices. He doesn't look horribly uncomfortable there. And they've got lots of different techniques and ways to repeatedly do the acupuncture and get a reasonably good result. They've been doing this kind of stuff for a long time, but it is always kind of nice to see the picture of it, right? And we can see it looks like a needle here, and then a needle lower, and then the wires going back to the little e-stim machine, and he's getting his treatment. So just to look through what we've got here, a lot of acupuncture research, right, is focused on mechanisms of action, and they're in these animal studies where they have already figured out a way to simulate the disorder in an animal model, and then we can just use the acupuncture as the treatment. So for example, instead of high blood pressure, right, where we might give them a high blood pressure medication, we'll look at a study on that in just a second, we can simply give them acupuncture instead and see what happens, right? And so on this slide, we've got the title of this awesome article. And I'll just read a little bit of this and then we'll talk about the article. And I include this guy for a couple of reasons. So one example of this kind of animal model research, right, is looking at hypertension by using rats that have been genetically modified to develop hypertension at a certain number of days of being alive. And actually, in this case, they did use these Wistar rats that at 180 days of life, they spontaneously develop hypertension. This is kind of like a model for people who genetically develop hypertension in their life, is the idea, right? And they also have other ways where they might induce the hypertension by putting a clamp on the renal artery or something like that. But in this study, they actually were little genetically modified rats that would develop hypertension. And they also, as some of the studies we'll look at, will use the same type of situation where it is a mouse or a rat that has been genetically modified to develop depression after a certain amount of time of being alive. And again, that is the idea there, is to sort of replicate the genetic component to it. But of course, we're going to see depression is a lot more than just DNA. There's a component there, but of course, there's a lot more than that. And then once the rats, they develop the hypertension, they will show the normal signs of untreated hypertension. And in particular, in this study, they're looking at things like left ventricular enlargement, thickening of the cardiac muscle, some classic signs of untreated hypertension and the development of heart disease. Next, they will give them an intervention. And, they're not going to give them the blood pressure medication, so they're going to give them acupuncture. And they will treat them X amount of time for, X number of days, and then they will euthanize them, and they will examine and see what's happened to their bodies. And what we find, actually, this study is really cool. They used stomach 36, right? Stomach 36. That was the only point they used. And they wanted to see if it would have an effect on the blood pressure and the cardiac muscle. And it did, right? It did. The left ventricle was able to be reduced. The cardiac muscle was less thick, and it even improved the shape of the actual muscle cells. So I'm going to send this study to you all later with a few other things, because it's really awesome. It's a great example of how we can learn the mechanism of action of stomach 36 for working on the heart and blood pressure. And I also like it because it really highlights, when we learn about stomach 36 in school, we learn it does all these wonderful things, right? It's good for digestion, of course. It's good to promote your strong energy, chi in the body. It's good for calming the shin, actually, right? And it's good for just treating all these different disorders. And if you remember, the stomach divergent channel in the textbook goes through the heart zone. So the divergent channel branches from the primary stomach meridian and actually penetrates the heart zone. And this is a mechanism for how the stomach 36 point can treat certain cardiovascular disorders. In ancient Chinese medicine, can treat the shin in ancient Chinese medicine, and can sort of strengthen that relationship between the earth and the fire element. Well, here we've got a really nice study which really reinforces that old idea that we had, that there is this connection between the stomach meridian and the heart. And certainly using that stomach 36 point works really great. And I also think it's a good idea. I introduced this one particularly because we're going to see stomach 36 in a fair number of the studies on depression. And I think stomach 36 is probably the most researched point ever. I mean, it's just article after article. And it seems like whenever there's something that they're trying to figure out how to work on or what the mechanism might be, let's try stomach 36 first. It certainly seems to be prominent in the research, no matter what the disorder is. But there is a lot out there about stomach 36 and the brain, and about stomach 36 being sort of neuroprotective and its functions with depression, anxiety, PTSD, and the hippocampus of the brain. We'll look at a little bit of that. But I included this one here also because, how many people these days suffer from or are at risk for some kind of high blood pressure or cardiovascular situation. And just another good reason why stomach 36 is something we should be thinking about with lots of our different patients. I think I use it on almost every patient. That's at least at some point, but certainly my depression patients get it all the time, pretty much every time, depending. All right, so we got about another, 15 or 20 minutes, and then we'll take a break. So hang in there, and then we'll get a chance to use the restroom or what have you. All right, so in our research review, we're really going to focus on acupuncture that's treating depression. We're going to look at some clinical trials. They'll use the rating scales, they'll use the biomarkers, and we're going to look at the preclinical animal model studies that will also, of course, they won't use a rating scale there, but they will have plenty of biomarkers, plenty of things for us to think about and look at in the nervous system. Now, depression disorders, this bullet is important, only partially understood in terms of neurobiology. And there's oftentimes some debate in the psychiatric literature about which biomarkers are most important. And that's okay, right? We're trying to take a big picture look, and I don't want you to be consumed with the details, even when we start talking about the neurotransmitters and the neuroanatomy and stuff like that. We're going to focus on the big picture and try to have a good understanding of what's happening without over-focus on the details. As we look at the psychiatric diagnosis part of this little course, we'll find that psychiatry has a lot of work to do in terms of becoming more objective in the diagnosis and treatment of depression. That's an area where they need to work, and I do think it's coming, but it's taking a while. Despite these challenges, right, there's lots of great research about how acupuncture can help and treat depression. And in the end, we're going to use this research to help us form some strong clinical guidelines to make our work in the clinic easier and better for our patients, right? That's the goal. Okay, so now we've talked about evidence-based practice. We've talked about components to the research studies that we're going to look at. And now we're just going to look at conventional psychiatric, psychological, licensed mental health counselor perspective on depression. We're going to get some definitions from this thing called the DSM-V and try to have a understanding of how they come about deciding a person, you have depression or you don't, right? And there are some key points in here that may be helpful to us as acupuncturists as well, actually. So psychiatric evaluations vary depending on the clinical setting. And for our purposes here, by clinical setting, I mean, is it an inpatient in a hospital? Is it someone who's been Baker-acted? Is it someone who just came to a health counselor in an outpatient setting for some help, right? We're going to just look at the outpatient one. There's three parts. There's urgency assessment. They will then do a psychiatric interview or a mental status exam. And possibly they will do some referral for some other testing if they think it's appropriate. We'll kind of look through each one of these a little bit. The psychiatric interview, and this is an important statement here, I think, is still the primary means of assessment and diagnosis in the clinical setting. So it's really subjective, right? They do try to make classification through symptoms and collections of symptoms in the DSM-V, all versions of it. But it is still primarily a subjective interpretation of the physician. And so while they don't have a lot of, we just looked at all those biomarkers, right? And that's great. Remember this back here, a couple pages, all these wonderful things, but they're really not using these yet in the basic clinical setting for diagnosis. It hasn't happened yet. Hopefully it's in some way coming. I think it is, but it's not there quite yet. So it's still pretty much a subjective situation. And we'll keep that in mind. And when people come to me with lots of different psychological or psychiatric diagnoses, and even, when I was working in the psychiatric office, I would listen and I would think about it. But of course, I'm acupuncturist, Chinese medical practitioner. I have to make my own diagnosis, right? We never accept a diagnosis as a chief complaint. And I have to go through my own differential diagnosis process to come up with my TCM idea about what's going on. All right, we can take a little look at the psychiatric interview. This is the biggest Actually, let me go back here. I don't think I said anything about this. The urgency assessment, this is essentially whether or not they need to hospitalize the person at that moment. Are they a danger to themselves or to someone else? And that's the very first thing that happens. And I mean, if someone comes into your office, you should be doing this as well, sort of just, in the background of your mind. Is this person, is this a dangerous situation? Do we need to get them some immediate, strong intervention or not? So that's the first step. And then in the psychiatric interview, they typically use some version of what's called a mental status exam. And this goes over all kinds of things. It says a wide range of biological and psychosocial data. The biological data that they get from there is more like, vital signs, maybe, age, gender, maybe some other things. It's not like a lot of testing typically, and a ton though of the psychosocial data. So the mental response and emotional response of the patient is what they're really focusing on and what they're really using to sort of score the exam and find out what their situation is. And we're going to look at one. We'll look at an example of one. Actually, I think I'll show you two in just a few minutes. Lab tests, brain imaging, and other medical exams, they're often used really to rule out other non-psychiatric medical conditions. And it is important, though, to think about this, and that's why we have down there the referral for a full medical exam. You yourself might want to think about this a little bit. Thyroid problems oftentimes can mimic mental health issues, and the mental health treatment in acupuncture might be different, but in the conventional world, the mental health treatment maybe doesn't really work. They got to fix the thyroid. Adrenal system is another one. Adrenal problems can mimic mental health disorders. And actually, something that's really prominent today that a lot of people don't think about is sleep apnea. And sleep apnea is a classic undiagnosed cause of depression, anxiety, sexual dysfunction, hypertension, all kinds of things. And so sometimes the astute clinician will recognize something else besides a psychiatric psychological problem, and they'll say, hey, wait a minute, we need to go and, you need to have a polysomnography test or something like that to make sure, so-and-so is complaining about you snoring all the time. You guys fight about that. Maybe you have sleep apnea, right? Something like that. So the actual sort of physical exams are usually secondary and ruling out other things, but that can be a very important component and something I think about with my own patients as well. And then this last bullet is a good one to think about. Indications for a referral for a full medical exam. And these are a little bit like red flags, kind of, in the psychiatric setting. So maybe your patient's coming in with depression or anxiety or PTSD or something, or, OCD, who knows? Well, these are things that we would think about as potentially something which would say, hey, wait a minute, we need to get a full conventional exam on you. History or current symptoms of the medical illness that's related to or can mimic the psychiatric symptom. And could be the sleep apnea, or could be the thyroid or adrenal problem or something like that. Evidence of a neurological impairment. Maybe this is post-stroke or something, or they had some other type of neurological event and they need some additional or alternative intervention. History of physical evidence of trauma, especially head trauma. And this is an interesting one because this could, I always ask my patients about head trauma throughout the course of their life, especially psychiatric one, because these things can take years before they show up. And it can be, if it's more recent, of course, it could be much more serious and a real cause for referral. Rapid onset of symptoms or onset of psychiatric symptom after the age of 40. When we look at the epidemiology and course and prognosis of depression, we'll see that most people start to develop it at a younger age, before 40. And I think generally with psychiatric symptoms, they do occur. There are some episodes earlier in life. new onset of a psychosis or any type of hallucination, obviously could be lots of things that can cause that, which could be quite serious. And that would also be a cause for referral. And then family history of illnesses that can cause psychiatric symptoms. Of course, we want to make sure that it's not something like that. So just keep these in here in the back of your mind to think about as time goes on. And then here we've got a picture of the mental status exam. And I'm going to bring this guy up here. Hopefully everybody can see this okay. This is there are all kinds of these out there. I picked this one because it's kind of a standard that I think a lot of people use. And it does a pretty good job of showing you what the practitioner will go through in determining, their diagnosis, how the mental status exam works. And it's all these little check boxes. And we can kind of take a look here and see, they will do general description. Okay. I'm not going to pay too much attention to the individual little marks here, but they're basically, how are things going? Are they, I'm not quite sure some of the things like tattoos and I don't know how important that is, but certainly the grooming, right? Are they taking care of appropriate hygiene? Because that can, if they're not, that can sometimes be a symptom. What else? Look at the behavior, right? How do they walk? What's their basic orientation towards you? Are there any strange things that they're doing? Listen to the speech. Is it fast or slow? Can you understand what they're saying? What's going on there? They'll look at the quality and the quantity of the speech, attitude towards the examiner. That's very interesting little section. And then they'll look at mood and they'll look at affect and try to understand what the patient's mood is, some other emotions that may be there. And they sort of make these little check marks as they go through their questioning of the patient and go through their intake. Is there any perceptual hallucination, right? And then there's a second page on this one. And they'll go through trying to understand what's happening in the patient's field of thought, if they have any delusions, phobias, what's the nature of their thought? Is it logical, neurotic, or psychotic? Is there some specific thing in their thought which is standing out, disturbances in their speech? And then try to see if their sort of sensation and cognition are functioning appropriately. And you can see it's, it's somewhat detailed. I do highlight, they have highlighted here this section called risk assessment. And this is important, right? Are there any preoccupations or possible suicidal activity there, thoughts of suicide, or they have a plan, something like that. And then hostile intent. Is there any concerns about any violent or homicidal type of activity? Okay, and that risk assessment, both for the conventional mental health setting and for us as acupuncturists, is pretty important. We'll speak about that maybe in a couple minutes. And then I have another one here. I'll send this one to you. And I like this one because it's a little different. Similar but different. They go through, again, basic same stuff here, but I find this one is helpful because they will give you some prompts for things that you can ask them. So down here under oriented, and I always, if it's a new mental patient, try to find out if they're oriented in time and space and things like that. Like if they're really having a problem, do you know who the president is or something like that? But they give you little prompts in case you want to try to elicit some of this information or find out more about the patient, right? They give you prompts even just for mood, right? Things that you could ask them. Acupuncturists, I think we do a pretty good job of questioning our patients already, most of us, some maybe more than others. But I just liked this one and wanted to include it for you all because it does have these prompts if you're ever thinking about, checking the mental status of your patient in the conventional way. And we don't have to read through all these. I just scroll through them for a few seconds here, and it kind of goes on, and they give you the references for how they came up with that one. So yeah, like I say, I will have those guys sent to you all at the end for your reference and your fun. And certainly you can look online and you can find lots more of those out there. All right. So continuing with psychiatric diagnosis, it's a syndrome-based classification system. What does that mean? That means that they collect various collections of symptoms, right? And they lump them together in different groups, and they try their best to categorize. If you've got these symptoms together, then it's most likely this. And if you've got these symptoms together, then it's most likely that. We will look at it specifically for depression in just a couple minutes, or maybe after the break. And it's the DSM-V is where this stuff comes from. And in the US, that's the standard in lots of Western countries. ICD has its own version, and it's very similar, maybe different in a few elements there. Other fields of medicine, its diagnosis is a little different, right? There's lots of physical signs that can go with the subjective symptoms. There's all kinds of biomarker things that we just talked about. And of course, you want to take a detailed history and then use lab results and imaging studies. And for the majority of medicine, right, the diagnosis includes objective data, very much so, as much or more than the subjective report from the patient. And it's usually that objective data which is somehow tied to the diagnosis and then tied to the treatment plan, right? Objective data, diagnosis, treatment. Psychiatry, well, it's still primarily the clinician's impression of the patient's interpretation of his or her thoughts and feelings. So that's quite a bit of subjective component there, right? That's pretty subjective. And great clinician can do a great job. It's still challenging though. And once they get this idea about the patient's symptoms, they cross-reference to the DSM and go to find the appropriate diagnosis. So when I have a patient that comes in and say, well, I've been diagnosed with this and this and this and this, I'm like, okay, I will take that in mind. I will think about that in terms of what your symptoms must be, and then I'll ask you. And I'll ask the patient, so, okay, what is really going on? And actually, I had a case this week, a young man about 30-something years old who came in looking for help. He had been given a diagnosis of major depressive disorder, generalized anxiety disorder, borderline personality disorder, and I think one other one, but I can't recall. And I said, okay. He's like, can you help all of that? I said, well, maybe. Tell me what's really going on, what you're feeling. And then he talked about his depression and how he's feeling. He talked about his anger a lot and his irritability and how that's created a lot of problems for him. And then we went along about our stuff. But it's an example of how you may hear all these diagnoses come out, keep them in mind, think about what they might mean. But then, of course, we have to not treat the other diagnosis, but we have to treat the patient's chief complaint and come up with our own diagnosis in the end. So despite the many advances in understanding the neural substrates of normal and abnormal mental states, there has been a ton, right? There hasn't been a real transformation in psychiatric diagnosis and treatment for over 50 years. And this statement actually comes from a textbook of psychiatry, a really great one of the most popular ones. It's cited in the reference Kaplan and Sadek Synopsis of Psychiatry. And it's an outstanding book. And they're really quickly to admit that despite all that we've learned, in the clinic, we're still kind of doing it the same way. Diagnosis is still primarily subjective. And the textbook is pretty honest about all of that, in the future, we do need to incorporate, right, this new information and get to a more objective state. So for us, right, we're going to learn the DSM here in just a little bit, but then we're really going to focus on what we actually know about the biological etiology of depression. That's a big thing for us. And that's going to tell us about the neuroscience that's going on there, tell us about some biomarkers, things that we can look at when we go to the acupuncture research, and then find out about how it really works, the mechanisms of action in treating depression, and sort of put it all together and see how, okay, acupuncture is really doing something here inside the body, and this is what it's really doing. All right, so before we start the DSM-5, it looks like it's 1:15, and that is a good time for us to take a break. So you all have done well. Thanks for hanging in there. Let's take a break, and we will come back at 1:30. So I will stop my share and see you all in just a little bit. And I don't know, Donna may have some interesting messages for you.
Recording stopped. Recording in progress.
All right, welcome back, everyone. Let me share my screen.